Good morning. I would like to thank Dr. Sweeney and Dr. Kent for inviting me to speak this morning. And looking at your title of your conference today, it's quite interesting. And I hope over the next 20 minutes or so to demonstrate the importance of for nurses and midwives of recognizing the global agenda and its influence, and the response that Irish nursing and midwifery are taking through a policy agenda that is appropriate and responsive to our population needs and to the development of our professions. So, in terms of the Office of Chief Nurse and our attitude policy, we acknowledge that the primary responsibility of nursing and midwifery policy is to achieve national public health goals through nursing and midwifery. And policy sets the direction for us and guides the healthcare system to achieve the desired outcomes. So many of you will have seen this slide before, and I didn't introduce myself at the start. My name is Tanya King, and I'm one of the Deputy Chief Nursing Officers supporting our newly appointed Chief Nursing Officer, Ms. Rachel Kenna. Together with my colleagues, Dr. Claire Lewis and Karen Green, we work with our project officers and a team of civil servants who are led by our principal officer, Mr. Eddie O'Reilly. So, as you can see here from this slide, we're quite lucky in Ireland because our Chief Nursing Officer operates at the level of an Assistant Secretary General. And that means that we as nurses and midwives have a voice at the management table in the Department of Health. And that's quite unusual across the world. Our Chief Nurse also provides leadership for a number of other units within the department. So strategic workforce planning, population health screening, the National Patient Safety Office, and the Professional Regulation Unit. She works very closely with our Minister for Health and the Taoiseach's department. And she works particularly closely with our operational healthcare services, and in particular, Dr. Geraldine Shaw and the Office of the Nursing and Midwifery Services Directorate. So we talk about the global agenda, and certainly our global agenda is led by the World Health Organization, who are working for better health for everyone, everywhere. And one of their aims, as we all know, is universal health coverage. Here in Ireland, that's also one of our aims. But achieving a universal health coverage is not an easy aim, and it is not something that is going to be achieved without significant work and intervention. There are a lot of challenges to policy development to achieve this, and it really needs a whole system approach. You'll all have seen this slide, I'm sure, many times, and the projected demographic changes that there are going to be here in Ireland, particularly the increase in the age of our population and the number of patients and clients that we will see over 65 who have multiple comorbidities. So we recognized some time ago that there was a need for us to look at how we could integrate care. And we acknowledged that it's a problem when a health service has a hospital-centric approach to care, with services here in Ireland in particular already operating at 100% capacity. So our solution, as we all know, is to look to achieve connected community care, where care follows the individual and care is provided as close to or in the home as we possibly can. So a case for change was made for healthcare reform within Ireland, and policies developed to support this. What we knew we needed was robust primary and community care services. We needed to provide appropriate and financially sustainable care to manage care needs in the community. And we needed to focus on prevention, self-management, and proactive coordinated care, something that nurses have done for a long time. So the answer to this, as we all know from a policy perspective, is Sláintecare. And these are the 4 strategic goals of Sláintecare. So to deliver improved governance and sustained reform, and developing the policies for nursing and midwifery to support this are a priority. To provide high quality, accessible, safe care, to ensure the health service is financially stable, and to enable the system to deliver the goals that our population and the people of Ireland want. Now, within the Chief Nurse's Office, we're very clear. Nursing and midwifery have the capacity to bridge the gap between access and coverage. Everybody, at some point in their life, will meet a nurse. From birth to death, nurses are involved in care. And increasingly, we are also coordinating complex care, no matter where we are, because as care moves into the community and particularly, we are seeing more and more complex care needing to be delivered in the patient's own home. So therefore, nurses need to fulfill their potential as primary caregivers to the full extent of our education and training. We know that we produce highly educated nurses and midwives. However, we are an expensive resource for the people of Ireland because nurses make up almost a third of the workforce. So that pay bill is quite large. So we need to enable the full economic value of the nursing and midwifery contribution across care to be realised and to be demonstrated. And in that way, we can change the reference point from which nursing and midwifery are judged. As part of Sláinte Care, we're moving towards a system of regional health areas. Through this system, services can be aligned to provide integrated care at local and at regional level. And regions will have the autonomy to deliver services based on population need, because that's the direction of travel. We need to be evaluating what each area's population actually requires and providing those services for those people. How do you develop a quality population needs-based service? Well, the first thing you need to do is understand the current demands and trends. And nursing and midwifery can contribute to this by collecting data and evaluating that data based on the population that we see. We need to predict the population needs and respond effectively to them. So if we see that there is an increasing level of dependence in our patient population, we need to be identifying that and responding appropriately to deliver the care that they require. So we need to look at the trends in the demand for service, no matter what area of service you're providing, whether that's in acute nursing, in intellectual disability nursing, in midwifery. Then we need to collect data. We need to inform any case that we're making for a change in service or for a development of service. So we need to identify what data is feasible to collect and what is relevant. Don't just collect data for the sake of it. And we also, as nurses and midwives, need to be aware of the economic considerations in developing service, in providing a service. So then from a policy point of view, we absolutely know that there are increasing opportunities for nursing with nurses as policy drivers to address the challenges. And we've seen so much of this in response to the COVID-19 pandemic. Nurses and midwives can inform policy and practice across all layers, and no matter what role you're in. They can look to lead on policy changes. We can translate the language of policy and patient care. We can coordinate care across multiple levels and not just across complexity. And especially since the COVID-19 pandemic, nurses and midwives have had their professional credibility acknowledged, and they are seen to be experts in their field. So what is our vision? Our vision, nursing policy, is all about the vision for the future. Where do we want to be 5, 10, 20 years from now? How do we improve experience and outcomes for our patients and clients? What does the nursing capacity to deal with that look like? And as health promotion workers, how do we support health, well-being, and social care for a person with care needs? So in terms of the international policy, again, we know that there's a lot of work going on in relation to advanced practice. And in fact, the International Council of Nurses produced guidelines on advanced practice in 2020. But we were ahead of the game because in 2019, we published the policy for the development of graduate to advanced nursing and midwifery practice, with the key objectives to develop the nursing and midwifery resource, which was responsive to patient and service need. We provided a new model for how nursing and midwifery could develop and where our graduates who wish to remain at the bedside could have something to base their career development on, whether that was to remain as a registered nurse at the bedside, to move into a specialty, and we acknowledge the value of our clinical nursing and midwifery specialists. But again, having a pathway to advanced practice so that nurses could work even more at the top of their license. We recognize the requirement to create a critical mass of advanced nursing and midwifery practitioners to respond to the emerging and future service needs. And more than anything, we are aware that advanced practitioners can promote service integration. This is our new model. It's a model, as I say, for professional development, but always, as we are nurses and midwives, keeping the patient at the center of care. COVID-19 has had huge impact across the world, and it will now also have an impact on policy and how we shape our health system for the future. Our frontline staff have shown an ability to adapt and rise to the occasion. Particularly, this was seen in the nursing and midwifery professions. We've adopted even more telehealth, which has enabled us to continue to provide care and to improve access and choice for clients and patients. And many new approaches to care delivery have been developed through innovation with nurses and midwives at the forefront. These are just some of the ways in which nurses and midwives have responded to the challenges presented by COVID-19. We've developed outreach services, which have ensured that patients have not been left behind. Utilizing the Attend Anywhere platform and remote digital devices at home, we've continued to support patients at home and increase access to specialist care. So many responses in terms of delivering care closer to home were developed through end-to-end pathways by our advanced nursing and midwifery practitioners. We staffed the community assessment hubs, which were vital in our response to COVID-19, but perhaps now offer a central point of contact in the community that will allow us to evolve and offer pathways of care for areas such as child health, chronic disease management. Our testing centres ensured that we could keep on top of the COVID-19 outbreak. And once again, our nursing and midwifery staff provided the experts in this. We saw huge support offered to our residential care setting at a time in which they were in significant crisis. Not only supporting them with the workforce, but supporting them with the development of guidelines and policies which allowed them to provide care for their patients. It's also worth noting the crucial role that was played during the COVID-19 pandemic by our midwives to shape the experience of women and to provide central high quality maternity care at this time of crisis. And now we're moving on to our vaccination centres. And once again, our nurses and midwives are leading in this, with most recently the development of a call to our students to become vaccinators during their summer break. We had the opportunity during this last year to test a proof of concept of a community virtual ward. This was a new development which came as part of a recommendation from the Labour Court recommendation at the end and the settlement of the nursing dispute. And to establish and test a community virtual ward was one of the targets. And this has now been completed. It was a very exciting development, and again, done in partnership with DCU's partner hospital and the community health organisation through Beaumont Hospital. So what is a virtual ward? It is a ward in which we can integrate acute hospital and a community nursing service. And it has been enabled by remote monitoring technology. It was, as I say, tested as part of the Labour Court recommendation and utilising the new enhanced nurse role as part of the contract to shift work to the community and to support the implementation of new approaches to chronic condition management. It is in line with Sláinte Care, and the overall objective is to facilitate a sustainable shift of care from the acute setting to the community through reorganisation of nursing services. And the report from the test of this proof of concept is available on the Department of Health website. In terms of workforce, we are aware that the State of the World's Nursing Report and the State of the World's Midwifery reports have been published. They have identified a potential shortfall in the nursing and midwifery workforce globally. And they have suggested that it is incumbent on every country to try and ensure that they have and can provide enough through their own domestic supply of nurses and midwives. So in terms of our future workforce and beyond the pandemic, what will we need to see in the development of our workforce? COVID-19 has brought the clinical readiness of our students into sharp focus. The future of the workforce relies on our students graduating as our workforce pipeline. And so we need to ask as our policy question, do we need to increase our domestic numbers in line with the recommendations from the State of the World's reports? So I think the answer is yes. And we need it to also to link it to the future models of healthcare delivery. So looking at where we're trying to deliver care, which is in the community, do we need to redesign and reevaluate the programs that we are providing that will facilitate nurses and midwives in the future to work more effectively within the community settings? The landscape of tertiary nursing and midwifery education has changed as well. And this will potentially enable options to increase our numbers, such as the creation of graduate entry programs. Again, this needs to be looked at across all disciplines. There are lots of challenges to workforce planning in terms of developing policy. So we need to determine the capacity based on our robust data. So we need to collect health workforce data. And as you'll be aware, there has been developments within our Nursing and Midwifery Board of Ireland to allow us to have more effective data across all the nurses and midwives that are registered here in Ireland to allow us to plan more effectively. We need to review our undergraduate programs, as I said, and look at the availability of clinical placement sites and accessibility of programs offered to attract a diverse student body into nursing. This is essential to provide nurses and midwives as a workforce that is grounded in science, technology, teamwork, and health equity. I spoke about our demographic changes, and they're resulting in increasingly complex needs across the whole spectrum of care, from both the improved survival rate for children with complex needs to our older population who have diverse health and social needs. And as I said, we're trying to shift to community-based care with an increased focus on a social care model. Consequently, nursing skills have been identified as a key area of competence to respond to the current and future service delivery workforce requirements. As I said, the world is changing, but some of the things will survive as the world changes. Nurses and midwives will always have clear ethical values. We know what our mission is, and we know that nurses and midwives will always put clients first. We are constantly trying to improve. We base everything we do on learning and evidence. And no matter what grade you are, no matter what your role is, nurses and midwives can provide leadership across the health service. As I'm sure you are aware, there is an expert review of the nursing and midwifery professions ongoing at the moment. We're hoping that their report will be published within the next few months. And based on their recommendations, there will be a clear policy position moving forward to which all nurses and midwives can contribute. So I ask you to remember, anything is possible. We, as nurses and midwives, write our own legacy, and it is up to us to contribute to the policy agenda. Thank you very much.